Pandemic fatigue or indiscipline, where are the cracks in the system in our fight against COVID-19? When we sit down, it's time for the conversation, and joining me virtually today is Dr. Joy Mugambi. Now, Dr. Joy Mugambi is the Vice President, East Central and South Africa at Commonwealth Medicine Association. She is a family physician leader with 21 years experience in primary healthcare. She doubles as a mentor and part-time lecturer at Kabrak University, Department of Family Medicine. She's also the Secretary General, Wonka Africa Region, Vice Chair, National Governing Council, Kenya Association of Family Physicians from May 2016 to this date. She is also the Secretary, Nakuru Division, Kenya Medical Association. Dr. Mugambi holds a master's degree in family medicine residency program from Moi University, and further a Bachelor of Medicine and Surgery from IMTU, and a diploma in clinical medicine from the Kenya Medical Training College. Dr. Mugambi, thank you for making time.
Thank you very much.
A month ago, the Ministry of Health was giving all indications that we are flattening our curve and we are almost out of the woods. Now, the Ministry of Health has changed tune and they're saying we could be approaching a second wave of infections. What changed?
Thank you very much, Ondiro. It's sure enough is a bit disturbing, but it's something that was bound to happen. Remember when COVID came in 7 months ago, we had a lot of mitigation measures that were put in place. Part of them were the lockdowns of various towns that had the high burden of disease at that point. Then there was the lockdown of flights into the country. So basically, we tended to lock any infections from coming out into the counties. Now that these measures were opened out, people have traveled, people have come into counties that didn't have COVID. And remember, most people tended to get lax after the reopening of the country because of the assumption that all is well. So yes, this may not be as classified as a second wave. It's more of a surge from what we had at the beginning. And we hope that this will end up being resolved as people get used to getting back to the preventive measures.
Dr. Joy, I want you to paint a visual picture. How dire is the situation, particularly currently with that surge? How dire is the COVID-19 situation in the country?
I will state it as where I work, because I work in the most rural county in this country. I work in Baringo, and I can attest to you, yes, the numbers have increased. We had a few cases in August. September, we went on a honeymoon period. We've really had a good break. But for the month of October, it's been devastating because our numbers have increased. I reside in Nakuru, which is also a county where I'm in the leadership of the doctor fraternity, and I do also sit in the COVID team for Nakuru County, and I can rest assure you the numbers are large. We do have the inter-county discussions between the two counties where I am, and we have challenges getting beds for patients within the two counties. Tells you the numbers are increasing and the cases are more severe than what we were seeing in August. So it's dire, and it's time people really took caution.
What does this say about our adherence to the COVID-19 protocols? Have we been flouting the guidelines and letting down our guard, and maybe probably how?
I think, yes, one, we have let down our guard. It's been 7 good months of trying to be good and nice. Then it's been 7 months of also hardships in terms of financial hardships to the general population, and even us, wherever we work. So it comes a time where you keep being told, even as a human being, do this, do that, do that. There is a time when probably you'll say cooking an egg is easier if I do these processes this way rather than going the long process. So yes, people I think have gotten tired. um, Most of them have never been used to covering the mouth and the nose, and this is something strange to keep putting a cloth around the mouth and nose. It's also, yes, it's a good habit to wash hands, but water, as you know, is a big issue in this country, and availability of clean water in all places is still a challenge. So maintaining that hand washing habit is a big challenge. In addition, distancing, it's really African culture for us to shake hands, and you're meeting with people and you're not saying hi. You're busy waving at them at a distance. So those aspects are really a big challenge. Then most people tended to run away from the cities and bring their children to the rural areas where it's open, it's safer, it's places where they can play and relate with their relatives. So also those challenges did come up.
From a medical point of view, we've seen Europe experience a second wave of infections. America looked like it was stabilizing. Now the numbers are also going up again. What would you say causes a second wave of infection?
To be able to say you've even finished off with a fast wave, we should have had a nice curve, had no infections for a time duration. But did we really get there, or we slowed down in terms of testing because we didn't have tests available to be able to continue testing? So for us, it's more of resurgence of the same infections that we had earlier on, rather than having a second wave, because we really didn't completely manage our first wave. Though out there, European countries, we've seen countries where they said they had had their last infection, they had not seen any cases within a time duration that was set out, but now they are starting to see new cases coming up, and that would be called a second wave. So for us, it sure is a resurgence, and the resurgence is now being seen in counties where we had no cases. This is where they are now coming up in larger numbers.
Why is this resurgence more dangerous than the first cases that we'd seen? Because you've mentioned that they're in rural communities. Why is this such a risky stance?
The reason is our healthcare system is not prepared for large numbers and severe cases. A call ago was all about oxygen, and was finding a facility within my region that has oxygen and that can take in cases that need to be supported with oxygen. But we do not have the ventilators that are in urban cities. We don't have the technology that would be ready to support a severe case. But now we are seeing cases that require respiratory support and that need oxygen. But within rural areas, the distances even to get to such facilities is far, and they are already overwhelmed by the surge that has already occurred.
Dr. Joy, what would you say 7 months on are some of the things that the Ministry of Health, both at national and county governments, have missed in their fight and response against COVID-19?
One, I would commend the work that was done at the very beginning in terms of containment. A lot was done in order to contain this infection by the Ministry of Health, by many counties. Though, yes, financial hardships have been there, and you have seen strikes happening. One, human resource has been a big challenge. Two has been the facilities, improvement of facilities is still a big challenge, because healthcare in some of the rural places is not as quality as it is in the urban places. So basically, yes, even the ones that did get machines that can run do not have the human resource to run these machines. So how do we run these places with, yes, a machine is there, but who runs it?
Now, a lot has been said about pandemic fatigue, but also the discipline levels of this country. For as soon as the Ministry of Health gave the indication that we might be flattening our curve, definitely some restrictions were vacated, for example, on socialization, the sale of alcohol, and even we began seeing political caravans going around the country. It was the DP in Kisii, today it was the president in Kisumu, horrific scenes with regards to COVID-19. How is this adding fuel to the fire of a resurgence?
I think one other great failure that happened in this country is we had a lot of top-down communication rather than down-up communication. Communities have solutions, but where you talk down to them and give them solutions from high above, they take one solution and the solution will come from politicians. Rarely does it come from us as health workers. I've had a community dialogue where I was asked, "Who am I? Who are you compared to a politician somewhere?" So my voice is not as loud as a politician's voice would be, and this is where we call upon politicians to be able to voice their issues with a lot of science in it in order for us to be able to flatten this curve. Remember, we've had reports even of reinfection amongst people. So really, as much as some people may have gotten infected and feel they are protected and covered and that the infection won't be back, it's a possibility. It can come back and it can be worse than the first round. So it's important for people to really take caution and really take it seriously. Yes, politicians are there. They are our voices out there. But can we use them as our advocates out there? And can also communities give us a solution? Maybe we told you to mask and probably you have ways of ensuring that the infection does not pass on. Maybe we've told you to personal distance, but you know a better way of personal distancing without using the modern way and being able to protect yourself. So we need to dialogue with communities and get community solutions that really work.
Mm-hmm. And speaking of dialogue and community solutions and also scientific solutions, moving forward, how do we ensure that the resurgence does not escalate to a second wave?
Community dialogue with inclusion of our politicians as much as possible, because these communities are the same ones that will come back to vote. They are the same ones that we need to ensure that development happens within our constituencies. So we need a lot of community dialogue, a lot of community education in partnership with each other. And in partnership with various other stakeholders, not just health, agriculture, education, bring them all together, because if you're in an area like where I am, people want to go to their farms and farm, but you're telling them to stay at home. So how do we work as a team also with the agriculture department? How do they get the seeds closer home without crowding in an aggravate place to bring them? How do they get their farm produce to the market without having to crowd and ensuring that there is no resurgence? So there's a need for a lot of partnership with all stakeholders sitting together and coming together to bring at least solutions that fit each community, because each community out of the 47 county has unique situations that need to be resolved.
Mm-hmm. I want us to talk about why we cannot get to a second wave of infection stage. And I want you to paint a visual picture. What would a second wave of infection mean for this country from a health standpoint?
I would say one thing we have to understand is infections will keep hanging around with us. COVID is here with us for a long time. We may not run away from a second wave, but we may have to face the second wave in a strategic manner, ensuring that we do not have large numbers getting infected and getting into the hospitals. Why we cannot have a second wave? Economically, we are not ready in terms of our healthcare system handling a large number of people. Our large population is elderly and also has lots of young people. So imagine taking away elderly people and having to lose a large number of elderly people and also a large number of young people being affected. That will have a real big negative impact on our economy. Any lockdown, currently we are feeling the pinch in our pockets and in terms of even what we are putting in our table. A lockdown would be devastating to all of us, and it is not practical. But we need to move on in terms of our economy. And the only way we can move on is change of behavior. Learn to wash hands, learn to personal distance, learn to mask as much as possible. And then now we can get out there and do business ethically without having to compromise our health.
And second waves have been termed to be more severe and more deadly. If it was to happen in this country, how severe would it look like?
If we had to get a second wave, it would mean we are choosing who we give a bed and who we give the ICU. And it would not be nice because, as I've said earlier, we have a very large population of elderly people. I would feel bad having to pick out between a young 30-year-old and a above 70-year-old, whereas all of them serve this country with love and with passion. So our main advice is to at least ensure we do not get to a second wave and ensure that we protect each other. The reason why we would get a second wave is having thrown caution to the air. You may not be wearing your mask properly, hand washing, and taking all the cautions that are necessary. So a high dose of the viral passing from one person to the other is more likely rather than when maybe one was protecting themselves and another one was hand washing and others were personal distancing. But
Dr.
our social activities need to change.
What we do in the next 2 weeks to 4 weeks determine how the resurgence curve will look like. At individual, community, and national level, what do we do differently?
One, at individual level, know your risk. Do I have am I likely to be exposing someone? Because yes, definitely people will get ill within this period. Do you have a cough? Do you have a flu? Do I come into work? Do I expose people around me? I'm not feeling so well today. I had a business deal today. Can I tell that person, let's communicate on phone rather than leave my house? Because it begins with you being the vaccine for the community by protecting others from yourself. Then, when it comes to communities, be able to treat people nicely because we've had people getting infected and you hear people talking about them. This is really an infectious disease, yes, but at least for people who are taking caution, you shouldn't be stigmatizing them in the community. Someone has had the illness, has fought it, is now ready to get out in the community, embrace them, and be able to support them. Even the one who's isolated. What support are people giving? Are you really supporting this family? Are you probably shopping and dropping outside their doors so that they don't leave the home and pass the infection round? If we can be able to support those who are self-isolating, it will really be cool and really be something that supports the community. For the nation, yes, we've got to get back economically, but it begins also with our leaders being able to be examples. Those who've had the infection, talk out because we hear from the community saying who has had it in our village. Speak about it. Tell the village, I've had COVID, I've fought it, I have won the battle. Yes, we've had a number lose the battle, but it's important to talk about it. So those things are things that we need to do in the next 2 weeks and be able to get the community going. And then if you know a school next to you, your school that you went to, support it. Do they have a hand washing area? Do they have the teachers having masks? Do the children have masks? Can you afford a packet of 50 masks and drop it in the school? Imagine if we are 10 of us dropping one packet of 50 masks. That will be 500 masks for a whole school. So we need to support each other. Serikali is us. And if we don't do something, then our communities will be affected way much more.
Dr. Mugambi, finally, there are countries that they've handled coronavirus in ways that will go down in the books of history as the worst crisis management. But there is a country that has done very well for itself, New Zealand. Second time it's been declared COVID-19 free. What is it that they're doing differently that we can emulate as a case study? Because the human body and the human nature is craving for normalcy. But normalcy cannot resume without us fully dealing with COVID-19. What lessons can we borrow from Jacinda Ardern?
First of all, vote a lady in. Maybe that's one big thing we can get to borrow. Jacinda is someone I admire very much, and she's a lady who's really used the community to get through with most of her political policies and engaging the community as much as possible. Where you engage the community will respond. And where you talk down to the community will respond with fear, yes, initially, but they will revolt with time. So I think where New Zealand has succeeded is part involvement of the community and ensuring that the community is also in the same page with you and is part of your solution. So we need to involve our community as much as possible and involve more ladies in leadership. I think that makes even a very big difference.
Dr. Mugambi, your parting shot.
My parting shot is COVID is here with us. We need to take serious measures around ensuring that we prevent COVID, but I call upon our leaders and our politicians to be the most responsive and the most responsible by ensuring that as they go around in terms of their political ambitions, they do talk with the community and explain to them what COVID is and help them transform their preventive and promotive strategies within those communities.
Dr. Mugambi, your love and passion for the community and community health has been evident these 24 minutes that we've had a conversation. Thank you so much for making time, and here's to hoping that the second resurgence will flatten just like the first one.
Thank you very much.
And to you, dear viewer, collective community responsibility is how we beat the virus. New Zealand has done it. We can do it. When we come back from the break, Vincent Odhiambo comes back with Social Watch.